Adolescent Anxiety. This presentation is brought to you by Christiana Adams, Leana Smith, Andrea Beck, and Spencer Stoddard. Where does anxiety come from? Situations and thoughts stimulate the release of hormones from the hypothalamus, which is part of the brain. These hormones then get into the bloodstream and stimulate other portions of the brain, including the hippocampus, which controls our emotions. These hormones also stimulate changes in the body, such as increased heart rate and respirations. The combination of physical and emotional responses make up what we perceive as anxiety. There are many different types of anxiety. Generalized anxiety disorder is described by the Mayo Clinic as a severe, ongoing anxiety that interferes with daily activity. An example of generalized anxiety is a person that constantly feels overwhelmed and stressed. They feel like they don't have enough time to get things done. They worry about forgetting things. They have anxiety coming at them from lots of directions. Obsessive compulsive disorder, commonly referred to as OCD, is a condition in which a person is captured by a single idea or thought process. The thought results in a repetitive compulsive behavior. For example, a person with OCD may have an intense fear of leaving their house unlocked. They'll feel compelled to check the lock several times when leaving. They may even return to their house multiple times during the day to check the locks. They may have a difficult time focusing on things while they are away from the home because they are consumed with this idea that they may not have locked the door. Panic disorder. The National Institute of Mental Health describes panic disorder as a sudden, repeated attacks of overwhelming anxiety and fear. Fear of being out of control, fear of death, or fear of impending doom. These feelings are exacerbated by physical symptoms, such as increased heart rate, profuse sweating, chest pain, and general weakness. This type of anxiety is usually associated with a specific activity or condition, such as going to the dentist or having to give a speech in class. During a panic attack, the person may feel like they're actually going to die from the situation. Post-traumatic stress disorder, referred to as PTSD, involves repeated, intense emotional and physical reactions as a result of a past trauma. PTSD is most commonly associated with military and first responders, but anyone who has endured intense emotional trauma can have PTSD, such as a person who has experienced sexual assault or someone who has witnessed a violent event. Social anxiety is an irrational fear of everyday social interactions. A person with social anxiety may be afraid of being judged, saying the wrong thing, or being embarrassed by others. As a result, they will avoid or limit attending social events. Anxiety manifests itself with emotional and physical symptoms. Some of the symptoms are fairly consistent with all anxiety disorders, while others are more closely associated with one type of anxiety. For example, a person with general anxiety disorder is more likely to feel like they're on the edge. They feel overwhelmed by work, school, and family obligations. They may feel like they're constantly struggling to keep it all together. Isolation. It's easy to imagine that anyone with anxiety feels isolated, especially those with general anxiety disorder, PTSD, and social anxiety. Some people with anxiety become experts at hiding their feelings. They're afraid to let people know how they are feeling. They don't want people to worry about them or to judge them. They may see themselves as unable to manage life or to be happy like the people around them. Unrealistic fears. People with panic disorder and social anxiety may have unrealistic fears about engaging in normal activities. For example, they may refuse to go outside because they are afraid that a tree might fall on them, or that they may be afraid of needles, so they will refuse to go to the doctor. Their fear is so intense that they feel like they could die from the experience. The fear is very real to them. Disturbed sleep. All forms of anxiety can cause sleep disturbances. The reverse is also true. Not getting enough sleep at night or waking up during the night can impair one's mental health. It is very important to address sleep disturbances immediately because the amount of sleep a person gets and the quality of that sleep can have a profound impact on one's mental health. Obsessive behaviors are most commonly associated with OCD. A person may not be able to eat unless they're sitting at a particular place at the table, or, like the example I provided earlier, they may not be able to leave the house without checking the door to make sure it's locked multiple times. Ruminating thoughts are common among people with all types of anxiety. One common ruminating thought is that the person feels that they are all alone and that no one understands how they feel. They think about how they should keep their feelings to themselves, which creates a greater sense of isolation. They don't know how to stop thinking about being alone. A person with generalized anxiety disorder may have ruminating thoughts that they are dumb or that they're going to fail a class, even though they're in fact doing quite well. A person with a panic disorder will focus on their fear. They'll think about that scenario in the head, the one that tells them that they are going to be hit by a falling tree if they go outside. They become trapped inside due to their ruminating thoughts. Persons with PTSD relive the traumatic events. They ruminate over and over about the hows and the whys and the what ifs, things that they will maybe never have the answers for. Persons with social anxiety will focus on the possibility of things that may happen, such as wanting to go out to a party and not having a ride home, even though they haven't even been to the party. The physical symptoms vary in intensity depending on the severity and type of anxiety. They may include trembling, sweating, shortness of breath, digestive problems, headaches, fatigue, and muscle tension. Some symptoms, such as shortness of breath, may last only a short period of time, while other symptoms, such as digestive health, can last months or years until the anxiety is resolved. Some of the common fears among people with general anxiety disorder include going to a new or unfamiliar place, not knowing how they will navigate that area or how they will get home, being around people for long periods of time, including friends and family that they love, speaking in front of others. That can be a one-on-one conversation or standing up in front of a classroom of peers. Being stuck in a large crowd and not being able to feel that they have control over who is around them. Pressure to perform. And that's not necessarily pressure to perform on stage. There is a sense of social pressure to perform anytime we're around other people. Sometimes people who appear the most outgoing, who are connecting with everyone, they have the worst social anxiety. They come home from social events feeling emotionally exhausted and dread having to do it again. Last of all, people with anxiety fear dying. They may be afraid that death will come to them by way of an accident, but they also may fear that death is their only way to escape their anxiety. To be clear, death is not the way out. Anxiety is treatable.
Hey guys, this is Leana, and I am going to be going over the next few slides with you, starting with risk factors. The first thing that I want to be sure to mention is that everyone is at risk of having anxiety, even if you don't have any of the risk factors on this slide. Genetics is something that plays a big role. We think there are studies being done to find the connection between the two, so I look forward to getting the information from those soon. Adverse childhood events, family dysfunction, and attachments all kind of could go, I guess, be grouped the same as additional risk factors or additional factors that could happen. I think of something like your parents getting a divorce during your childhood and having family dysfunction or maybe attachment issues because one parent is no longer in the picture. Negative peer relationships are another factor that may play a role in increasing anxiety. And that would include friendships. Maybe your best friend moved away. Maybe your best friend's just not your best friend anymore. Maybe you're getting bullied in school. Maybe you just have a breakup with your boyfriend or girlfriend. Lifestyle is another factor. So if you are someone who maybe just an unhealthy lifestyle of what you eat or smoking or drinking or things like that, or maybe you're really, really healthy, but your schedule is packed so full that you are constantly stressed about having to go from one thing to another and do all of them well. Financial stressors is another factor. So worrying about money, where it's coming in, where it's going. And isolation is another factor. And I think that's more of a side effect of anxiety. A lot of people will isolate or want to be alone more often, but that actually increases the anxiety because you're not getting out and being around people. And so it's making the times that you do more difficult. I want to spend a few minutes talking about panic attacks and positive ways to respond to them. As any of you who have had a panic attack before knows that they can be very scary and they can cause a lot of fear that you can't breathe, that you might die, that you might pass out, that someone will see you. And it's very scary. But the first step in overcoming panic attacks is to accept that they're going to happen. So rather than trying to fight it or do something to make it stop, just accepting, here it comes. I'm having the panic attack. My heart rate is speeding up. I'm feeling lightheaded. My stomach feels sick. Whatever it is, accept it's happening. And then to allow it to happen is the next step. And that means knowing that you're having it and saying, okay, bring it on. Here we go. And feeling all of the different feelings and letting them happen. This helps give you power back from the anxiety and the stress and the panic because now you are giving it permission to take place. Breathing, slowing your breathing down, counting to 5, things like that helps, one, to change your focus, but also um, breathing quickly is one of the things that causes the lightheadedness. It causes you to feel worse when you're having a panic attack. So slowing that down will decrease some of the symptoms. Positive self-talk. So in the middle of all of this, these scary things happening, be sure to tell yourself you're doing a great job, that you've survived many panic attacks before, they can't kill you, and you're surviving this one. Use distraction. So having someone talk to you about your favorite sport or watching a TV show or doing something that keeps your mind off of everything happening to you, to your body. And then have patience. It's going to be difficult. Your anxiety has probably been around for a while, and it's going to take a while to completely overcome it. And then last but not least, talk to your friends about how they can support you. Like I said, sometimes when you're having a panic attack, having them talk to you about something is helpful, or just having them know what's going on with you can be helpful because then they know what's happening. So when you have to leave a room and go somewhere else, they know and they can support you. They can cover for you. They can tell the teacher, that something's going on, whatever it is. So having people who know about it makes it less scary. Self-talk. We all have a voice in our heads that is our thoughts, and it tells us positive things and negative things, and usually those things are about ourselves. And so what I would like to encourage you to do now would be to recognize the negative thoughts that you have. And I'm talking about the thoughts to yourself. And an example I'm going to use is just of, let's say, doing homework or getting schoolwork. So let's say you take a test, you get your grade back, and it's not what you wanted it to be. And so you get it, and your first thought is, how could I do this? I'm so stupid. What is wrong with me? How am I going to get into a college if I don't do this? I'm never gonna get the job that I want. I'm gonna be poor the rest of my life. And and so having that negative thought process, just recognizing that you're having it is a good start. And then questioning it of, okay, seriously, is this one bad grade going to jeopardize my future that much? A lot of times we can make things a little bit bigger than they are when we're talking to ourselves. And then stating the positive of, well, at least I didn't fail, or at least I turned it in, so that's good. Or, whatever it is, at least I went to school today instead of pretending I was sick. Um, and then turning the negative into a positive. So now saying, okay, yeah, I got a B, or yeah, I got a C. I didn't do as well as I wanted, but now I know what the teacher is looking for on this. Now I know that I need to study a lot more going forward. So I'm going to plan for that. And then that brings me to the next part of taking action. So now that you know what you need to do for the next exam, you can plan ahead, maybe study a little bit every day to get that grade. And then in the future, you've got the A and you're not thinking the same negative thoughts. Expectations. Anxiety is treatable. So even though you have anxiety, the good thing is that it's created in your own brain, which means that you have the power to change it. And your attitude about it is your choice. You can let it continue to make you afraid and increase your fear, or you can start trying to take back your power and build your confidence back up. You are capable of setting and reaching goals. You've made it here, that you've made it this far. And so you need to give yourself permission to let things go that you can't change. So noticing when, or realizing that there are things that you can take care of, and then there are things that you cannot fix. And the things that you can't fix, you really have to be able to learn to let them go so that you can focus on the things that you can. Acknowledge that your best is good enough. You are good enough. I mean, all any of us can do is our best. And that you are empowered to manage your anxiety. So you always have the power to do what you need to do. And then recognize your value as a friend, as a sibling, as a child. So knowing your self-worth, knowing who you are, and that the anxiety is not you. It's just something that you have to deal with and overcome. Health management. So I'm going to say that these are some of the easier things that you can do to help yourself with anxiety, although they're not really that easy. Eating a balanced, healthy diet. So eating things that you know are good for you, whether it's fruits and vegetables or meats. I'm not going to tell you what you should and should not eat other than eating healthy foods. Engage in physical activity daily. So doing something, and I'm not saying go run a marathon, but doing something physical so that your body is using up all of that extra energy, and instead of storing it to use for a panic attack later. Grow patience. So learning to be patient with yourself and the people around you. And that also comes with planning and reducing stressors. And the ways you can do that is to plan ahead, give yourself enough time to do what you need to do, but also cutting down on the amount of things that you are doing, and narrow it down to only what's important to you. Hydrate, drink lots and lots of water. A lot of the symptoms that come with a panic attack and anxiety, like an increased heart rate and things like that, happen as well when you're dehydrated. Some things that can cause dehydration are stimulants and diuretics. So that would be your caffeine, your sodas, your coffees, things like that. And then practice good sleep hygiene. None of us are at our best when we haven't had enough sleep.
This is Andrea. In the next few slides, I am going to be talking about how you can overcome some of the emotions and internal thoughts that are associated with anxiety. The first is anger and mood swings. We've all experienced anger. It is one of our basic emotions. There are several ways people express their anger, but most of them are ineffective. However, feeling angry is not the same thing as acting angry. Highly sensitive people tend to be easily irritated and often seek immediate gratification by spontaneous release, such as hitting, kicking, or screaming. It is okay to be angry, but it is better to use that energy to create positive actions, such as going for a walk or a run. Not only will exercise release the tensions you are feeling, it will be beneficial for your physical body. If you feel anger building up inside, think before you react. Take a moment to ask, how will my actions play out? What will be the benefit? If you cannot control the situation, simply let it go. Extreme mood swings are also a common symptom of anxiety. These may be direct or indirect symptoms. Although it may be difficult to do, identifying the cause of your change in mood is the best way to figure out how to reduce your emotions. Be assertive. To be assertive means expressing what you think and feel in a positive way. It is also understanding the boundaries of oneself as well as others. A great deal of anxiety stems from not speaking up when assertiveness is needed. Some may think that because you are speaking up for what you want, it needs to be in an aggressive way. However, this is not the case. There is a difference between aggressiveness and assertiveness. Aggressive behavior is hostile and angry, while assertive behavior is honest and deliberate, making you seem confident and in control. It is healthy to be assertive. Expressing your feelings and opinions allows you to put yourself first. It also helps you control stress and anger, which then reduces anxiety. To be assertive, you need to speak up, but do not raise your voice or feel you need to have the last word of the conversation in. Use your words wisely. People will think about what you have said after it is over. Set boundaries that you are comfortable with. Do not let people manipulate you. Believe in yourself and know who you are and when to say no. It is okay to say no. Ruminating thoughts. These are responsible for bringing people to a state of extreme worry that transforms into anxiety because they are repeated over and over. As mentioned, a common ruminating thought is that a person may feel all alone because no matter what they say or do, someone will not approve. So they keep their feelings to themselves. So what can be done to stop ruminating thoughts? Well, the first thing is to recognize the thoughts and practice self-control of those thought patterns. So stop and use the what-if thinking to take action and create positive solutions. Your family and friends can be a great resource by reminding you of positive memories that get you out of ruminating. If you are in a situation and are trying to come up with a solution, stop and ask, has this ever happened before? How was the problem solved? Also ask, are there any barriers that prevents me from being able to react appropriately? It is okay to be uncomfortable. Being uncomfortable is actually a normal part of life, but use it to your advantage. Remind yourself of the challenges you have overcome and accept new challenges that come your way. Guilt and worry. Guilt is a negative feeling that causes one to think about actions from the past, while worry is thinking about the future. Guilt is often associated with lack of confidence or low self-esteem, feelings of inferiority, or thinking we are not good enough. Uncontrolled guilt can turn into anger. Hanging on to negative emotions takes control over you, and positive emotions are not allowed in. However, taking ownership of your actions and apologizing to someone you have offended will lessen your guilt and allow you to move forward. Worry is stressing about the outcome of something before it even happens. Jeffrey Navid said, worries often stem from exaggerated expectations of negative outcomes. Doing something rather than worrying about something is the most effective antidote to worry. Scary thoughts. So just like ruminating thoughts that are played over and over in our minds, scary or intrusive thoughts can be apparent with anxiety. These are frightening thoughts that may become obsessions about events in the future with an individual or a person that is close to them. Scary thoughts are very real to a person and can come on all of a sudden. A lot of times these are about harmful actions, such as someone getting hurt by a knife or something. Thoughts are not based on truth, but are based solely on imagination. Many things can be done to break the cycle. First, break the thought habit, such as saying, I'm going to go for a walk, or I'm going to talk to a friend as soon as this thought pops up in my mind, so I can be distracted. Avoidance makes the thought worse and can lead to obsessions. Realize that you need to accept a thought, but focus on what is needed to move on. If you have a negative thought, accept it, interrupt yourself to give you the facts of that thought, then find a way by doing something else to stop it. Overcoming scary thoughts takes patience and persistence. Maya Angelou said, you may not control all the events that happens to you, but you can decide not to be reduced by them.
I am Spencer Stoddard and will be discussing ways to overcome anxiety. Defense mechanisms, avoidance and suppression. According to the Assessment Technology Institute, avoidance is when someone perceives a situation that creates anxiety, which they decide to avoid or neglect the situation. When someone avoids a situation that they are responsible for, it can still continue to build upon one's own anxiety. For example, when someone has a test to study for, they avoid studying for it, but find themselves unprepared for when it comes to actually taking the test. Suppression is where someone voluntarily denies unpleasant thoughts. For example, when someone has been taught the dangers of drinking alcohol, they suppress that thought and say, "I will try to quit drinking next week." These defense mechanisms could eventually bring out more anxiety. Other poor strategies in managing stress that people resort to are alcohol, illegal drugs, and illegal use of prescription drugs, which according to the Controlled Disease Prevention Center can lead to family and legal issues in the future, thus causing depression, then withdrawing from therapeutic activities and social support. Empowerment. Abraham Lincoln is a great example of the positive consequences that stem from facing your anxiety with courage. According to Medina, President Lincoln experienced many challenges throughout his life, including death of many intermediate family members, feelings of inadequacy due to lack of higher education, and limited experience in politics. He struggled with threats to his opinions that made others harass and persecute him, which increased his anxiety, causing him to isolate himself. Even with all of these oppositions and trials, he was still able to be one of the greatest presidents of the USA. This example of empowerment can inspire you to overcome the feelings associated with anxiety and strive to fulfill your potential. Acceptance, an opportunity to begin healing. Admit feelings of anxiety is the first step in order to overcome anxiety, as well as identifying what is causing the anxiety in order to change or fix it. Reaching out to others, such as family, friends, teachers, and school counselors, nurses, and support groups can give you the social support needed in helping you get the extra motivation and inspiration in learning to cope and overcome anxiety. They can also help lead you to other professionals, such as mental health specialists or doctors, that can assess you and offer you treatments and medications that can help you with anxiety. Time management is a challenging part of life that can also lead to anxiety. According to Wang, those who do better at managing their time have lesser amounts of anxiety in their everyday life. So how does one better manage their time? It first starts with looking at yourself and identifying what you struggle with. For some, it is identifying what their priorities are or making and reviewing a priority list. For example, if you prioritize running a marathon in a few months, then you will need to come up with an exercise plan. But make sure you don't overschedule other activities that stop you from exercising that day. Don't hurry yourself through tasks. It might wear you out too fast to the point that you don't have enough energy to do your other tasks. And make time for yourself. That gives you the greater satisfaction and extra amounts of joy in your life. By finding ways to manage your time, there will be less amounts of anxiety in your everyday life. Takeaways for this presentation are for you to apply what you have learned to your personal needs. Some might be good at not overreacting to stressful thoughts, but don't make time for themselves. Or others might have a positive attitude in life, but overreact to every stressful situation they come across. Whatever it is that you struggle with, identify it and learn the ways from professionals, peers, and yourself in finding a way to overcome that thing that causes anxiety. Overall, do what is best for you. Do the best you can until you know better. Then when you know better, do better. Maya Angelou. If you are having a crisis or know of anyone else having a crisis, there are resources out there that can get you the help you need. And they include the following: Crisis Text Line, Youth Helpline, and the National Alliance on Mental Illness Helpline. The first offers communication through text, chat, call, or email. You get directed to a professional crisis counselor that will listen to your concerns, available 24/7. The second offers you the opportunity to speak with a trusted peer in your age group, also available 24/7. The third offers answers to questions regarding other mental health resources, such as local support groups, services, treatment options, and helping family members receive treatment, available 12 p.m. to 8 p.m. Mountain Standard Time, available Monday through Friday.